In this video, you're going to learn how to stretch out your neck and shoulders. My name is Tom Wellman, a physical therapist from Apex Orthopedic Rehabilitation in Providence, New Jersey. At the end of this video, you're going to learn how to do these easy stretches you can do at home without a lot of props or anything like that. Just very simple stretches. The key is commitment to it. But let's talk about a couple of reasons why we want to stretch out these structures for injury prevention and also for recovering after injury. Sometimes you lose range of motion after injury, never quite regain that motion. And that's what the goal today is, to kind of give you a few things you can work on with a big impact, okay? So let's go over the anatomy of the shoulder and neck just briefly, kind of give you areas of what regions we're trying to work on. So we want to work on some stretches for the neck in this region right here. A lot of times what we lose is we get into like a forward neck position. We're going to work on a stretch specifically for that, one of the most common stretches. We're also going to work on the upper back area, which can affect neck function, okay, neck function, and also shoulder function. This is our shoulder joint right here. This is our shoulder blade. In this region right here, we have a series of muscles that make up the rotator cuff, deltoid, and this is the main joint we're going to be working on, the glenohumeral joint. We're going to work on mobility for this joint. It also affects the scapula, which moves against the rib cage. But all these different areas are related. They affect each other. So there's a couple interesting things you'll find when we work with people in the clinic here. There are certain people that come in with shoulder pain. They'll say, Tom, the pain is right here, it's centered right here, I don't have any neck pain. And that is actually something that's originating from the neck. That's why I like to combine these stretches, especially for someone that's coming off an injury. Sometimes you'll have neck pain, neck issues that are actually showing up as shoulder pain. I have people walk in all the time, they say, I've got no pain in my neck, I got pain in my shoulder, I even sometimes have a difficulty lifting up. And only until you start moving the neck do you realize that part of the pain is actually originating from here, but it appears to be a shoulder issue, okay? So it's very important, I find, to really address both issues. Another scenario here is you can have someone that has shoulder surgery or a shoulder injury. They've traumatized their shoulder, especially see this after rotator cuff repairs or any kind of procedure, even an impingement syndrome where you're kind of lifting and you're compensating for a while. Sometimes what happens is you're kind of trying to move in an odd fashion here. All the muscles that go from the shoulder complex up into the neck area stresses the neck. So you start developing a neck issue in addition to the shoulder issue. So the importance, this kind of, this issue right here, we want to really work on mobility on both areas. Now the baseline is mobility, so we're talking about flexibility. In other videos we'll talk about strengthening these areas too, but the baseline is getting some mobility first. And addressing these areas, and that's what we're going to talk about in the video. So be careful. None of these stretches, when you're doing them, should last more than 3 to 5 minutes after doing it, meaning you shouldn't feel like the rest of the day you're miserable from doing these stretches. What we're trying to do is slowly increase the length of tissues, so we have increased length. That does cause little micro tears, which cause a little inflammation. So if we do aggressively stretch, we can actually delay healing and actually get tighter. So we want to slowly, kind of gradually increase the motion. It's really a marathon. Really increasing the length of tissue is a gradual process over time. When we initially start out, we'll have people hold for 1 or 2 second holds. We'll have them do numerous stretches, 1 or 2 seconds, pressure on, pressure off. So if let's say you're stretching your shoulder here, you're bringing your shoulder up, you've got limitation in shoulder, called the shoulder flexion. Pressure on, 1, 2, pressure off, especially in the early stages after an injury. When you've got an injury that's been around for a while, especially after 2 or 3 months, you don't have to be as protective or as careful about it, depending on what's affected. So we want 1 or 2 seconds, and then we want to release it. Eventually, you want to increase that time to, let's say, 30 seconds. That's our kind of gold standard. 30 seconds, they've seen a real improvement in lengthening of the tissue. It's the most efficient time period. And it's a long time to hold the stretch, okay? But we're trying to affect that tissue. 3 times for 30 seconds is the eventual goal. When you first start out, you just had an injury, first 2 or 3 days, you really don't want to aggressively stretch some of these things. If you're doing an old injury after 2 or 3 months, something that's stable, and not a recent fall or anything like that, you can, or if you had more of an injury prevention program, you can be a lot more aggressive. Still have to be careful and kind of listen to your body, but you can do a lot more without the same restrictions. First 2 or 3 days, a little gentler, gentle movement, but don't force it, okay? Think of it this way: you've got all this swelling and inflammation, after an acute injury, a fall or trauma or twist your ankle. To aggressively stretch at that point, even though it feels stiff, the solution at that point is really not aggressively stretching. So I just wanted to clarify that so you're safely go into it. Okay? All right, our first one that we're going to talk about is for your neck, okay? One of the common things we'll see is in the clinic is people lose this direction. They start getting into a forward head posture. They're slightly forward. The ears are forward from the tip of the shoulders here. So tip of the shoulder and alignment to ear. They're slightly forward. We want to get it, so what they often lose when they have a forward posture is they lose the ability to go upright like this and extend. So our stretch is kind of a two-part stretch. It's a cervical retraction. You're going to pull in, and then you're going to roll your head back as far as you can. And a little wiggle at the top. Then back down. That's one repetition. And we're really trying to reverse that forward head posture that a lot of people have. And what you'll notice oftentimes, whether it be after injury prevention, is that as you improve that direction, it actually improves the other planes of motion. So it's a very effective exercise. It's probably the most common one. It is, in fact, the most common two-part exercise I give for the neck. Really powerful, really wonderful. Should not cause more pain. More than 3 to 5 minutes of pain after doing any of these stretches, you're doing it wrong, or there's something else going on, and maybe you need a formal physical therapy evaluation. Okay? So keep that in mind. So just a review: cervical retraction with extension. Okay, on to our next one. Okay, so the next one, I think I'm in view here. Next one is for the upper back. Okay, so we're going to sit in a chair. You can even put a roll behind you like this. You're going to take your hands and you're going to interlace them through your fingers. And what you're trying to do is you're trying to stabilize the neck. At the very top of the chair here, at the top here, we could put a towel if it's a little bit too hard, or any kind of surface where you have a little edge here, okay? Place it here, lean back, support your neck, lean back into the position till you feel a good stretch. Sometimes I even add a little breath through your nose, breathe out, and sink into the stretch, okay? And then back. So starting position is here. Also, we sometimes will add a stool, put one foot up on a stool, but just stick with this one. You should feel a lot of pressure in the upper back area. Really effective, simple stretch. You also see in future videos, we'll do things on foam rolling in this area as well, but we're working on that upper back area. So to review, fingers together, lean back, pressure on, 1, 2, pressure off. Okay, the next one we're going to discuss is shoulder external rotation. It's basically almost when you see a pitcher or a thrower, it's this direction, the movement in this direction, okay? We're going to show this lying down, two kind of versions of it. One that's going to be a lower, you're going to bring your arm back using a cane for a stretch, which we'll show you. And then another one where you use the cane between both hands and you go straight overhead. This particular direction really affects the function of the shoulder. So it's really important that that's very mobile, especially with people that like doing a lot of sports, throwing sports, overhead, any kind of movement like that, pitching, throwing, anything lacrosse. Anything like that is very, very critical for movements, especially over shoulder height. So we've got to get the stretch done. Good for injury prevention. And if it's an area that's gotten stiff after an injury, essential to get this motion. Okay, so let's go over it. Okay, so you want to take up a towel, place it underneath your arm, about 45 degrees away from your trunk. Place your palm facing you, towards you. Lean back flat. Never put a towel behind your head. Keep it nice and flat. You can use the right arm if you're stretching the left arm all the way out till you feel pressure at the end. A 1 or 2 second hold. As you get more mobility, then you're going to move it up a little higher. And we're going to do almost like a goalpost stretch, okay? Like a T. Excuse me, not T, a goalpost, excuse me. All the way back. So both arms are going back into almost that pitching position that I talked about earlier. And hold for 1 or 2 seconds. Make sure you don't arch your back so all the motion is occurring from your shoulder girdle and not anywhere else. All the way back, pressure on, about 30 times. Okay, so the next one we're going to talk about is shoulder flexion. So we want to come up in an overhead position, arms straight over like this. Okay. So while in your back, keep your hands about a little wider than your shoulder position. Gently bring it to an overhead position where you feel good stretch, 1 or 2 seconds, and slowly back to overhead. Okay? All the way back, a little pressure, 1, 2, and then back. Make sure your knees are bent and your back stays flat while you're in that position. The next one, you're going to be nice and upright, hands a little wider than your shoulders, and palm facing away from you. Slowly back, pressure on, 1, 2, pressure off, all the way back, repeatedly. Okay, remember, and then you can go a little bit more narrow, so you're closer to the side of your body. Pressure on, pressure off. The next one, you can take a belt or even like a yoga stretch. You want to be above the wrist crease where the belt contacts or strap or rope. So it's above your wrist, so you're not holding onto it, you're not grasping it. See how I kind of moved into position? Slowly pull it up. If you're stretching the right arm, you're putting it over your left shoulder. All the way up, pressure on, pressure off. Eventually, you're going to go beyond 1 or 2 seconds. There you go. And that's that. All right, so you've got the stretches, neck, shoulder, upper back area. Remember, start out 1 or 2 second holds. 30 times, let's say. You can do it, kind of a meal plan, I call it, the breakfast, lunch, and dinner. Or start out with once a day just to see what your tolerance is. Sometimes you only notice problems the following day, sometimes not actually the day that you're doing it. And realize these are kind of little micro tears. They're trying to cause a lengthening of that tissue. And to do that, we do have to create a little bit of trauma to the muscle bellies and also the other tissues in the area, ligamentous and such. So start with that. As you go further along, then you start going into longer stretches, like 3 times for 30 seconds for sustained pressure on that, and it actually starts developing. You get the flexibility a little bit faster. That's 3 times for 30 seconds. But I like to start out a little bit first before we add that extra time to see what your tolerance. Be careful with it. If you've just had a recent fall injury, the first 2 or 3 days, most times you don't want to aggressively stretch these structures. It's basically a chemical reaction. It's very hot in the area. You've got damaged cells, damaged tissue, and you really want to be a little gentle active movement, but nothing forced, nothing to the very end range. And the key to any stretching thing is to get to the end range. So all these stretches, you got to get to the end. That's as far as my joint goes or shoulder goes. Hold that. It's total time at end range. Okay, that's what equates to eventually increasing length. You should see a difference in 2 to 3 weeks as far as how far you're going. The hardest thing as a patient, or not even a patient, let's say you're just doing injury prevention, is seeing exactly those changes. Sometimes they're more subtle. So that's the hardest thing. But listen, you're going to see some great success. Embrace these exercises. If you got something from this, subscribe to our channel. Share it with someone like that, and just like us if you think it was a beneficial video. And if you have any questions, place them in the comments. We love to hear from you. Any topics you want us to cover in the future. Have a great day.